Okay, so for my last day of clinical, I had 2 patients. My first patient, which is what I did my care plan on, he was there for like behavioral health evaluation. I got COVID, so he's just kind of awaiting that period before he can go to the mental health floor. But I actually wanted to do my reflective measure on him, just because I feel like, so for him, he's kind of been in and out of foster care early in his life, but then he was placed at like a behavioral facility, and that's when they said he started like acting out. He was acting suicidal, homicidal. It sounded like from a lot of the notes that he wasn't coping well. Like he would get upset and like he just wouldn't really know how to like control his emotions. But then they said that afterwards, he can hopefully get back into the foster care system and he won't even go back to that facility, which kind of like I think is great, just because I mean, it's also hard because it depends how much he would be fluctuating, because that's also hard too. Like sometimes stability is better, but I just truly think that like some of these kids just need love, and like I just pray that, you know, he could be put in a family where he can feel that love and like know that he has purpose, because I can't imagine being in a facility not having, you know, you don't really have like the whole parental like role, like, you know, your parents, like their job is to show that they love you and to provide that attention, and you know, they don't have like one or two people dedicated to them even at that facility. And also I wanted to talk about like the values and ethics, which I know we talked about in seminar too, but on the mental health unit even, I remember being like on the girls and Peds unit, and it's hard because it's kind of like they're like in a way kind of like creating like little adults. Like this is how you can be like almost independent in a way, but also like cope, and like I get it to an extent, like help them cope, help them breathe, but like some of the things I was just like, one, it's just so sad that they're even there for these reasons. Like I mean, I would say like 8-year-olds that are like suicidal, and it's like, how do you even know what that is, you know? But it's kind of like an ethical value dilemma for me too, just because when I was on the floor, there wasn't a lot of love shown to those kids. It was a lot of like constructive teaching, and I totally understand that, but I also see the side of like, okay, we know that maybe home life isn't good, so I don't necessarily think it's wrong to show them compassion and love. But that was kind of like a big no-no, like no hugging them, you know, and also just like some of the things that they would have to do. Like we would have like like I had a 6-year-old one time that got written up for not bringing her shampoo back out of the shower, and it's just like things like that. It's just like, it's hard for me because I'm like, I also didn't, like, it's not something a normal kid would do. Like I also was not carrying my shampoo out. Like it's not something that they even do at home, and I get like the structure, and I get the side, but I also get this other side, so it's kind of like a dilemma for me. My other patient was the 9-month-old who had some sort of like respiratory, like rhinovirus, so like kind of just like the common cold going on, but it sounds like ever since she was pretty little she would have trouble with like breathing, and like every single time she got this respiratory illness, they said she had been in and out of the hospital a lot. And then they were talking about the reactive airway disease over asthma based on her age, and I hadn't really looked into that. So for my little research section of the Relfection, I was looking at UPMC Life-Changing Medicine, they have an article on reactive airway disease. And so they state that reactive airway disease is often diagnosed in young children who are showing signs of asthma but are too young to have lung function testing that can confirm the asthma diagnosis. So, like, it's still the same signs and symptoms. It's basically just that the infants can't do the testing, which is very good to know, because it definitely, if you see that, you know, like, what to expect and, like, what meds are probably going to be given. Like, you correlate it with that. And then my other thing was for the spirituality aspect. Definitely with the 9-month-old, I really saw, like, patient-centered care, or, like, family, not patient, with there being the grandma there, the mom there. It really just shows, like, especially with a 9-month-old, like, you're not going to talk to the 9-month-old about, you know, their needs necessarily. Like, you're definitely, you know, relying on those parents or grandparents, and also just, like, caring for their needs as well. So I found this section in the spirituality of nursing. So according to Mary Elizabeth O'Brien, on page 195, she states that, oh, I'm a page off, sorry. Oh man, I'm losing it. Okay, so it's actually page 197. Although the primary goal of a pediatric hospital unit is the care of an ill child, parents are an important resource. Also, they need attention. The spiritual care of the child should include spiritual support of the parents. In discussing spiritual ministry in a pediatric unit, Arnold of 1992 asserted that pediatric ministry must include the entire family. Because Arnold noted hospitalization of a young child represents a crisis situation, needs are usually identified in spiritual language: hope, trust, love, and acceptance. Such needs may be met through the use of religious resources or simply by developing caring relationships with the child and family. And that just really stuck out to me, just because it's like you always hear about, like, the family-centered care, but I really think that that pertains a lot to peds, like, in an extra level, just because, like, they, like, that's their lifeline. And also the parents are, like, under so much more stress, I feel like, when it's, like, their kid, you know? Kids shouldn't be in the hospital. So definitely, like, another thing I could probably think of that would be, like, super, super family-centered care is, like, those unexpected situations. Like a car accident, you know, something that wasn't expected. But I feel like what I've seen more has been, like on, like, adult in adult health, you know, the units where it's more older patients who are dealing with maybe, like, chronic or even acute conditions, but they're either expected or, yeah, I would say they're all kind of, like, more expected that I'm seeing. So it's just definitely, like, a whole different atmosphere when you're dealing with, like, peds, and it really is, like, a crisis situation for them. So I definitely thought that that was a really good example to pull out, and just making sure that we're addressing their spiritual needs as well. So yeah, overall it was a really beneficial day. I got to pass meds, yeah, I guess, give the syringe medication to the baby, which was really good experience, especially, like, with her being old enough to, like, kind of resist it. It's not fun, but it's definitely, like, good experience. And then, yeah, just being around the family and just getting that family-centered care. So overall, it was a really good day.